Welcome to PT Micro Lessons, fast lessons with big impact. In this lesson, we'll focus on high volt pulsed current. We'll break down what it is, how it works, and how it's used clinically in physical therapy. So, what is high volt pulsed current? First, it is a monophasic pulsed waveform. It uses a high peak voltage, but maintains a low average current, which improves patient comfort. Because it is monophasic, it allows for a net electrical charge in the tissue. This makes it useful for managing acute edema and supporting tissue healing. Here is the twin-peaked monophasic pulsed waveform. As you can see, it uses a very short pulse duration with a long off time, resulting in a low total charge. This allows the use of high voltage while maintaining patient comfort. Voltage can be thought of as the driving force of the current. So with higher voltage, there is a greater ability to drive the current into the tissue and overcome skin resistance. Okay, let's look at the most common indication for high voltage: tissue healing. High volt pulse current can promote tissue healing by mimicking the body's endogenous bioelectric signals, which support the healing process. This supports cell migration, also known as galvanotaxis, allowing cells to move toward the area of injury. It also contributes to tissue repair and may assist with bacterial control. Now, let's look at how it is set up. The active electrode is placed directly over the wound. If the wound is infected or at high risk, we use a negative polarity. If the wound is stalled or needs epithelialization, we use a positive polarity. The dispersive electrode is placed nearby, typically about 3 to 5 inches away. Frequency is set around 100 pulses per second. Pulse duration is approximately 100 microseconds. Intensity is set at a sensory level. Lastly, the treatment time is commonly 45 to 60 minutes. Next, we will look at edema control. High volt pulse current is most effective in the acute stages. The goal is to reduce capillary permeability and limit fluid accumulation. The fit parameters are the same as those used for tissue healing, sensory level only. For electrode placement, the negative electrode, which is the active electrode, is placed directly over the area of swelling. The positive electrode, which is the dispersive electrode, is placed nearby, at least 3 to 5 inches away. An important note: in more chronic cases, we may instead use a setup that promotes a muscle pump, which brings up an important point. High volt pulse current is not appropriate when muscle contractions are desired. To make this point even clearer, it's important not to use high voltage pulsed current for neuromuscular electrical stimulation. While high volt can produce a visible muscle contraction, its pulse duration is very short, typically around 100 microseconds. In contrast, NMES commonly uses pulse durations between 200 and 600 microseconds, which more effectively recruits motor nerves and produces a stronger, more comfortable contraction. This is true whether the goal is muscle strengthening or simply creating a muscle pump to help reduce edema. As a result, high volt is better reserved for sensory level applications, such as edema management and tissue healing, rather than as the primary choice when a therapeutic muscle contraction is desired. Lastly, before we wrap up, let's clarify a common term. You may hear high volt pulse current called pulse direct current. This is misleading. Direct current flows continuously in one direction. It is not pulsed. High volt pulse current is monophasic, but it is still a pulse current. Even though the current moves in one direction, it is delivered in pulses, so technically it is not direct current. However, you may still see the term pulse direct current used in the clinic and on exams. That's it for this PT Micro Lesson. Like and follow at PT Micro Lessons for more fast lessons with big impact on physical therapy topics.